to quickly tell about Avana. Avana, we are an online healthcare platform. We help people manage, prevent, and reverse chronic lifestyle diseases. And we have a team of integrative medicine doctors, nutritionists, yoga therapists, mental counselors. It's completely online and virtual. Anybody from the world can join us. And we provide the whole ecosystem around any person. And we have programs based on cancer, cardiometabolic disorders, hormonal, and now we are introducing infertility as well. So let's just jump into the topic of preventing heart diseases. And I would just like to, like we all know the primary causes right now. India is one of the leading countries where young adults are getting succumbed to heart attacks, and it is said it was in a lot of articles on heart diseases have been published, and it said that we have in one of the 3 heart attacks in our country, one person is under 40s, and now it is also coming under 30s, and in the 30s and even 20s are getting this serious issue. And lot of in the coming last decade, it's increased from 60% to 100%, I think. And primary causes, everybody knows that you should not smoke, you should not drink, you should not be obese. But I would like to know, Dr. Lenny, let's discuss the primary causes of why it is becoming so widespread, the heart attacks in the youth. So we can go to the primary and secondary, and then henceforward go to other areas.
So Shruti, I've got a presentation that I'd like to make, and you'll be surprised that I'm not even looking at what you guys look at primary and secondary. Okay. Because when I actually show you some of the data that is coming out and people will look at it and understand why, you realize that what we are doing is barking up the wrong tree. Right. So it's kind of detailed presentation. I'll go through it as fast as I can, and then we can get into some questions. I don't know how much time I have, so depending on the time, I'll cut off some of the slides. It's quite a long presentation. But it's quite an interesting one, because it will give you a new perspective to how you can prevent heart disease very early in life.
Right.
And what are the telltale signs for the same? So if I am allowed to share my screen, and if you allow me to use that presentation, it will be easier for me to handle it. Yeah. You see my screen?
Yeah, if we can.
Okay, so let's get this underway. So in this short session that I want to do this evening, I'm going to talk to you about the cholesterol story and let you judge how stupid it is. Right? And then I'm going to talk about something known as insulin signaling and why is it so important in heart disease. Right. And why is it so important? Because how we can control it by what we do.
Yes.
And then I'm going to be touching upon toxins and detox and how it affects heart disease. And the next 2 are very important: exercising right and controlling stress. Now, why exercising right? Because with the recent deaths of a few very well-known actors and very public figures, there is a lot of crap being written about the way that we exercise and that it is harmful, etc., etc., etc. So I want to put some data that is there in the public domain. Unfortunately, neither modern medicine nor people who help you exercise are looking at this data, and it's sad, right? So, so you can take your own conclusions from there. I'm going to tell you what I believe in and how it has helped my patients. So with that, let me get started. So the background we all know is the heart disease is the #1 killer, right? But for too long, the traditional heart protocols have been emphasizing that you need to lower cholesterol to kind of prevent heart disease. This has been wrong. Why? Because emerging science is showing that cholesterol levels are a very, very poor predictor of heart disease. The standard prescriptions of lowering it, such as ineffective, low-fat, high-carb diets, and serious side effect causing statin drugs, actually are really covering up the real cause of heart disease. So for years, doctors have been misled by pharma companies, and you can't put the blame on them. The blame has to be squarely on people like us who are doctors who listen to them. But this was done with the sole intention of supporting a $30 billion a year cholesterol-lowering drug industry. All right, and most pharma companies have minted money on this. Unfortunately, it is shoddy science, manipulated research, and basically corporate greed that has perpetuated the myth that hides the true culprits of heart disease. And my dear friends, do you want to know what that is? That is sugar and not fat. Inflammation, stress, and high-carb diets, full of processed foods. Obviously, each of those lobbies that do this processed foods also profit from it, yeah? So the real tragedy is that by putting all our attention on cholesterol, we have forgotten to look at the actual cause of heart disease. And what are they? Inflammation, oxidation, sugar, and stress. And we don't look at this at all, right? Now, cholesterol numbers are a pretty poor predictor of heart disease. And this is where the medical establishment got it wrong. Why? Because more than half the people hospitalized with heart attacks have perfectly normal cholesterol levels. And about half the people with elevated cholesterol levels have perfectly normal, healthy hearts. And you'll understand why. So is this what I'm saying? No, there is enough evidence. This is one of the biggest papers that you cannot miss it. One of the first of the many. New England Journal of Medicine, and this is what was quoted about the nurses' health study. This involved about 120,000, that's one like 20,000 women since 1970. 82% of coronary events in the study could be attributed to the lack of adherence of these 5 factors. Don't smoke, don't drink alcohol in moderation, engage in moderate to vigorous exercise for 20 to 30 minutes a day, maintain a healthy weight, BMI under 25, eat a low glycemic, low sugar diet with omega-3 fats and fiber. Where do you see the mention of cholesterol here as the reason for heart disease? This was one study that very clearly didn't even talk about cholesterol to avoid heart disease, all right? And there are many like this. So the myths are many, many. You begin with cholesterol that cholesterol is the cause of heart disease. That's a myth. Actually, cholesterol is only a minor player in the cascade of inflammation, which is the cause of heart disease.
Right.
Then you have saturated fat is dangerous. My dear friends, saturated fats are not dangerous. Killer fats are the trans fats, from which, where we have the partially hydrogenated vegetable oils that we use on a regular basis, thinking they are heart-healthy oils. Any of these hydrogenated vegetable oils that are in the market, you call them under any name, they are trans fats. They are the ones that are dangerous. They say higher the cholesterol, shorter the lifespan. My dear friends, higher the cholesterol protects you from so many diseases. Gastrointestinal disease, pulmonary disorders, your hemorrhagic stroke, more importantly, your cognitive function, which is so very important. Then they say high cholesterol is a predictor of heart attack. It can't be further than the truth. There is absolutely no correlation between heart attacks and cholesterol. Absolutely no correlation. Then you have lowering cholesterol with statins. Statins will prolong your life. Till date, not a single study shows this fact. There is no study to show that statins have an impact or a significant impact on longevity. Then they say statins drugs are useful for men, women, and the elderly due to cholesterol lowering action. You should not be using statins on women, because there are studies that show that the chances of breast cancer and diabetes go up drastically in women that use statins or cholesterol lowering drugs. These are good for people who are middle-aged men for a short duration, maybe post an MI, or if they've had an MI and they're showing high amounts of inflammation, that is when you need to give it to them. Then there's another myth, the idea of good and bad cholesterol. And I want to kind of decimate this right now, because everybody needs to understand that LDL is not bad cholesterol, for God's sake. All right, LDL is not bad cholesterol. You have to understand that there are different kinds of LDL. You have the small, dense kind, which are harmful, and I'll tell you how they come about. And you have the big, fluffy kinds, which actually kind of repair and regenerate your body. So you need to understand that cholesterol is required for the repair and regeneration of your body. It doesn't come from diet alone. Diet contributes to 20% of that cholesterol. The balance is made in your liver to repair you. So the small, dense or oxidized LDL is what we should be calling bad LDL. Why? Because when it gets oxidized, it's like butter getting rancid. So that rancidity causes this oxidized LDL to become bad, and that's when it damages you. It's not, unfortunately, in our country, we don't even go to check whether you have small, dense LDL or you have large LDL. Very few labs in the world do that, even in the United States. Now, when does LDL get oxidized? LDL gets oxidized or damaged when you have too much of stress, whether it's environmental or mental, and there is too much of glycation. What is glycation? Too much of sugar. So your sugar in the blood goes up, your LDL gets oxidized. And always remember, when we say HDL is good cholesterol, not all of it is good. Because when you have a drinking binge of alcohol, your LDL also goes up. And that is not, your HDL also goes up. And that's not the best HDL to have either. Now, cholesterol is responsible for your hormones. If you want to live well, your hormones have to be balanced. Where do they come from? They come from cholesterol.
Yeah.
Then you have to have fat in your body. That fat needs to get synthesized. That needs to get digested. Where does that come from? That comes from bile acids, which are made from your cholesterol. Then you have your cell membranes, the cell wall. Each cell wall is made of a cholesterol bilayer. So it's an essential component of that cell wall. Cholesterol is responsible for your entire immune system, my dear friends. So lowering it just damages the regeneration of your immune system, which is fighting to keep your body in these times in good health. And finally, we all say we need the sun for vitamin D. You may have all the sun in the world, but if you don't have enough cholesterol, you will never make vitamin D from the sun. You know how that happens? The sun has to hit your skin, and on your skin, it will change the cholesterol in those cells into vitamin D, provided you let the sweat dry on that skin. So you need the sweat, you need the vitamin D, but you also need good levels of cholesterol.
Right.
So remember this, all right? So this is where your cholesterol becomes a hero and not the villain that we make it out to be. So cholesterol is extremely important for health, longevity, and thousands of important functions in the body. And we have discussed a lot of them already. I won't waste time too much on this, but I just want to explain to you how the cholesterol actually functions. So cholesterol is fat, and I'm putting it in a little easier for you to understand than what's on your screen. So cholesterol is fat, and it has to be transported through a water medium. It doesn't get dissolved there. So it needs to be carried on carriers or trucks. Those trucks we call LDL and HDL. LDL takes it from the liver to where it is supposed to go and do its job. 90% of the times it goes to a particular area where the cell has got damaged to repair it. HDL brings the excess back. Now what happens is, while LDL is gone, it will only go to those cells which say, hey, I'm damaged. It gives out a signal and says, you need to come here and repair me. It will not enter any other cell. But when it is circulating around and it is in excess, it needs to be shifted to HDL. For that, it needs something known as phosphatidylcholine, PC. That shifts it from LDL to HDL. Unfortunately, phosphatidylcholine comes only from diets, right?
Yeah.
And HDL brings it back to the liver, after which it gets converted to your hormones and then to bile salts and bile acids. So all of this physiology happens. This is the way it works. When does LDL get oxidized? It gets oxidized because when it is circulating before phosphatidylcholine can shift it, that is when it can get hit by high sugar or other oxidative stresses in the blood. And those oxidative stresses could be many, could be toxins, could be high sugar, could be high insulin, could be anything that is creating stress in your body. So that is how your physiology and biochemistry of the entire cholesterol works. Now, LDL cholesterol does form fatty deposits on arterial walls. This is what the theory has been. And hence, it causes plaques which then block the arteries. HDL, they say, on the other hand, is heart-friendly. It just counters the action of LDL. All this is bullshit. I just told you what exactly it is. Now, if LDL causes atherosclerosis, obviously logic dictates that there should be a strong relation between blood levels of LDL cholesterol and atherosclerosis, right?
Yeah.
So, when you look at the evidence, atherosclerotic plaques are not just wads of fat on the arteries. They are not. They are instead growth within the layers of the arteries. So you have the innermost layer, which is through which the blood flows. Then you have the one in between, and then the outer one, which is the outer covering of the artery. So between the innermost, that's intima, and the media, you have the plaque formation taking place. Now, when you look at it, it is not full of fat at all. It has got a whole lot of other things. It's got calcium there, it's got muscle cells there, it's got connective tissue there, it's got white blood cells there, it's got a little bit of cholesterol there, and it's got fatty acids there as well. So it's a mixture of a lot of things. So cholesterol becomes an innocent bystander there. It happens to be there to repair the damage that probably the oxidized LDL has done to a cell. That is when cholesterol comes there. Otherwise, it wouldn't have come there at all.
Dr. Lenny, can I ask you one question out
Yeah,
here?
sure.
Lot of us, when we go to our normal cardiologist and we are asked to do a lipid profile, and on the basis of that lipid profile, the range is so much, right? Like you have the LDL and the HDL and your total cholesterol and everything.
Yes.
So in this case, like I think what it also should be, you said that the LDL and HDL are not really the marker, should not be only markers that we actually should be concerned. But then functional practice, functional nutrition is very different from your normal cardiologist. But people do, I mean, they normally also judge, and then they come, oh, my cholesterol is high, and oh, my lip. So is there any particular range we should be thinking about, or we should be concerned about?
So Shruti, I don't look at cholesterol levels at all.
Okay.
All right. I will tell you the reason why, because I have a list of markers that you should look at, which will tell you whether you've got heart disease or not.
Right.
Cholesterol is not it. But we do understand that when you look at triglycerides,
yeah,
you need to understand there's something wrong with your diets.
Right.
You're on a carb-heavy diet. And I'll tell you why that has a role to play. We'll come to that. Just give me a minute, I'll be there. All right. So there are many other reasons why plaques are formed, and I have put some of them here. Look at the number one cause there. Number one cause is nutrient deficiencies.
Yeah.
Number two is poor glycemic control. There's nowhere that there is where we have mentioned that there is cholesterol there. Homocysteine, and I will come to homocysteine soon. Cigarette smoking, stress, nitric oxide depletion, and there are a whole lot of others, including dietary trans fatty acids and deficient omega-3, excessive omega-6. Let us understand this a little bit, and I'm not going to get into this more, but it is, okay, so there is a lot of data to tell you that it is not LDL that is bad for you, it's oxidized LDL that is bad for you. And this was among 28,000 plus participants of the women's health study, where 46% of the first cardiovascular event occurred in women with LDL levels less than 130 milligrams, which is supposed to be normal or desirable, set up by the National Cholesterol Education Program in the US. Okay, this was done there. Now, research in both animals and humans have shown that oxidized LDL is better predictor of atherosclerosis and cardiovascular disease than regular LDL. And that is what I wanted to tell you with this. There are other studies that have shown where they showed that elderly Belgians which had higher level of oxidized LDL were accompanied by a significant increased risk of heart attack, regardless of what the LDL levels were. So LDL levels could be normal, but the oxidized LDL levels have gone up. And then oxidized, so all of the LDL level, if it is oxidized, you're in big danger. But if you have high amounts of oxidized, high amounts of LDL and none of it is oxidized, you are absolutely all right. So unless you differentiate between the two, you will never know whether the cholesterol levels are to be looked at all. And there's a lot of data. There's a Japanese study that is going on which showed that during surgery, plaques that were removed from carotid arteries that had high levels of blockages had high amounts of oxidized LDL. And their LDL, normal LDL levels were okay, but oxidized LDL was high. And so it's oxidized LDL that causes problems, not normal LDL. All right. So when we look at a lot of the other things that happen and a lot of the other data that came in, they showed that people who had fish oil, and this is important because of the kind of oils we use in our diet, which are trans fats. So if you are using a lot of fish oil, that is omega-3, you had lesser amount of cardiovascular events. And why is this? Because what do trans fatty acids do? They go to the cell membrane and they block the food or the nutrition from entering the cell so that the cell becomes sick. If the cell doesn't get its energy, it gets sick. What do the omega-3 do? They go and knock off these trans fats and they open up that.
Right.
So that is the reason why if you have bad food, at least you need to supplement yourself with good omega-3 or fish oil. And they showed that the fish oil level group had a much lower level of LDL cholesterol and had much lower levels of cardiovascular disease.
What I see is generally people have this imbalance of omega-3 and omega-6. The omega-3
exactly, they have.
So
they have
high.
Yes, it's very different. In fact, one of the major reasons why people have vilified red meat is that the moment you have red meat, the current red meat that is processed or comes from farms where you have animals being given corn, which is not their normal food, the omega-3, omega-6 ratio goes up from 1:2, which is anti-inflammatory, to 1:25, which is completely pro-inflammatory. And that is the reason why they say that red meats are pro-inflammatory. So that is so if you don't want this thing, you need to have good amounts of omega-3, which we don't seem to have in our diets. I'm not getting into this. Let me just get off this. Okay, so this was a trial which was actually used to say that omega-3 doesn't work. Okay, when it first came out, this was a study that showed us that omega-3 doesn't work. And I remember I was questioned at one conference. They said SSI prevention trial has just come out, it doesn't work. It actually did not say anything. It just showed that people who were on omega-3 had a longer period of less cardiovascular events and better mortality. Unfortunately, these findings were shown much later. All right? I think somebody's talking.
Can you please switch off your microphones? The participants are requested because it's disturbing. Thank you. Yeah.
Now, this was another one, which was the Leon Hart study, which actually showed why omega-3 actually works better. And I will not get into the details of that because I have a lot of other things that I want to share with you. As far as statins are concerned, patients who have low CRP levels, so this is one thing that happened way after we started objecting to statins from, what we call functional medicine point of view, that they said, no, we don't give statins now for lipid lowering. That means to lower your cholesterol. We are giving it because we want to reduce inflammation. So fine, and they said that's the pleiotropic effect of statin. And so, yes, it's great, because if you have a heart attack and you have too much of inflammation in the body, you can have a second one, which can cause problems. So if I don't want that to happen, I would want to give you statins as an emergency. But
Right.
I can't give you statin to prevent it, because statin has its own side effects. You can't be taking the baby and the bathwater and throwing it out. Just because oxidized LDL is going to harm you, you can't be stopping the production of cholesterol at all. Why? Because cholesterol is required to repair your body. You can't be doing that. And that's what we have been doing. And so if you want to prevent getting or get this pleiotropic effect from some other molecule, the best to do is natural vitamin E, natural tocotrienols. Gives you the same effect of statins, including lipid lowering, which is required to some extent, but it doesn't cause the side effects of statin. So that's another thing that I wanted to share with you. The other one is cholesterol, is vitamin D and cholesterol.
Yeah.
Remember, you need to have good amounts of vitamin D if you don't want heart disease, you don't want osteoporosis, you don't want depression, you don't want cancer. If you have difficulty in losing weight, please check your vitamin D first. If you don't have vitamin D in toxic levels, you will not lose weight. If you want to live long, you need to have good amounts of vitamin D for a longer period of time. Finally, the sugar that I was talking to you is terrible. Terrible, because the moment your sugar gets in and it is not being metabolized in your body, and I'll tell you the reasons for it. There is something called glycation that takes over. So you'll have glycation end products that happen in your body. And the one primary way that LDL cholesterol gets damaged is because of the oxidative stress generated by free radicals. The second one is by glycation. Glycation directly damages your LDL cholesterol, right? So sugar is at the scene of several crimes, specifically those related to heart disease. And we think that if you get diabetes, it's okay. No. If you remember and you check, nobody who's got diabetes has not had high blood pressure. When your sugar goes up, much before your sugar goes up, at least 3-4 years earlier, your BP will start showing signs of going up. Why is that?
Yeah.
Why is that? That's because of this particular thing. Sugar plays a key role in heart disease. You don't want heart disease from the very beginning. Don't let your sugars go up. And there are ways of understanding when your sugar is going up, and I'll show you what is that. One of them is looking at your triglyceride levels. If your triglyceride levels go up, that means you're eating too much of carbs. And so going forward, you're going to have your sugars going up as well. All right. There's a lot of evidence on sugar, but I just want to mention this. In 1992, they did a study of healthy centenarians, people who had completed 100 years. And they wanted to see what was common among them. And they found 3 things. Low triglycerides, like I just said.
Yeah.
High HDL cholesterol. And the third one, surprise, surprise, low fasting insulin. What does insulin have to do with longevity? You will understand when I talk to you a little later. So if you correct your diet even today, 2 of these will automatically go down. 2 of these will automatically go down. You'll have triglycerides dropping, you'll have fasting insulin dropping.
Yeah.
And so your health immediately improves. So do you understand now that whether you get heart disease or not, 2 of the major conditions are in your hands. You can take control of it. It's not in the hands of anybody. It's not in the hands of God. It's in your hands. He's given it into your hands if you believe in God at all. All right. So please understand this. I've just put this because most kids are exposed to this, and this is how they get problems with insulin signaling. Every possible sauce that is there in the market has got high corn fructose syrup. Every so-called sugar-free juice has got high corn fructose syrup. Each of this substances that have this high corn fructose syrup is going to kill you. Why? Because it's creating so much of triglycerides going up and so much of liver dysfunction that it's not funny. So please remember, high corn fructose syrup, look for it. Read the label of what you're giving your kids. Now, I was talking about insulin signaling, and I'm going to rush through this. Please understand, normal insulin signaling, low blood sugar, no artery disease, low triglycerides. Now, when you have insulin signaling disrupted, where you get inflammatory metabolism. Let's see what happens. You have inflammation and oxidative stress, both driving heart disease. All right. So, what is it that drives this? It's the environment. And so, to start with, one of the altered pathways of environment is your diet, is your nutrition, is your food system. So, we've just discussed it. Inflammation, when omega-3, omega-6 goes up, inflammation, low antioxidant, you get oxidative stress, high glycemic carbohydrates, you get increased blood sugar, fructose, you get increased triglycerides. So these are the diets, the nutrients that we have on a regular basis. What do? They disrupt insulin signaling. Let's see what happens next. So we know this, but we ignore it. We know this, but we ignore it. There is a lot of influence of nutrition on chronic disease. And so there are enough and more studies to show you. If you're following a Mediterranean kind of diet, there are tons of them. 70% decrease in heart attacks, cardiac death, total mortality, 60% decrease in cardiac events in CVD. And there are tons of them. And I've just listed them out for you to show you that if you have a good Mediterranean type of diet, which has got lots of lovely colored fruits, vegetables, omega-3 fatty acids, good amount of what do you call them?
Antioxidants.
Yeah, antioxidants, but the oils, you have the cold pressed oils and lean meats, you have yeah, cold, not the so the cold pressed oils, yes, that is where you have, this is the kind of outcomes you get. The second thing that the environment gives you is toxic chemicals. And whether we like it or not, our food chain is full of them.
Yes.
All right. So you have air pollution, you get lead from air pollution, you get lead from your food pollution, you have other heavy metals from pesticides. You have glyphosate from your herbicides, my dear friends, herbicides, and they kill your gut. You have bisphenols and other endocrine disruptors. Where do you get your bisphenols from? From every container you have in your house. Your bottles are plastic, your containers are plastic, all are bisphenol. These bisphenols mess with your endocrines. They mess with your hormones. And that's when you have an endocrine imbalance. That's when your thyroid levels start going down. And that all has a link to your heart disease. Don't think it is not linked. You will not get heart disease out of isolation. You're getting linked because you're getting stress, oxidative stress from the fact that the endocrines are being disrupted by these toxins. And so this is the kind of toxic overload that you put yourself on. And when this happens, the key area that it affects you is by disrupting insulin signaling. And why is this so important? I'll just be very brief on this. What does insulin do? It takes glucose and helps it to get into the cell, which is then used for energy. So it is one of those hormones that helps you get energy from what you eat. Now, if that is disrupted or that is affected, your entire energy supply to your healthy cell is affected. What does logic tell you? That you're going to be sick because your basic cell is not functioning properly. And if your cell is not functioning properly, you can never be healthy because these are the cells that keep you healthy. All right? So what do? Avoid plastic containers to get rid of the endocrine disruptors, avoid Teflon-coated pans, and eat organic local vegetables and fruits if you don't want these heavy metals to get into you. I will just give you why and how heavy metals affect you. And why I'm telling you this is because over the last 20 years, I have actually treated over 28,000 patients by just detoxifying them for heavy metals, heart patients. So I can tell you with authority how these heavy metals actually affect you. So the air that we breathe is full of heavy metals. The food that we eat is full of heavy metals. The groundwater is full of heavy metals. And so I'm not going to get into the chemical part of it, but this was the first study that told you why heavy metals are bad. Just look at this. This was done in 92. This was the NANS 2. It said that blood lead levels, which should have been normal at around below 20 or below 30 were considered normal. At less than half of that, you had cancer and people dying of all-cause mortality. And even more than around at 24, so 30 was considered, 30 micrograms per deciliter was considered normal. At 24, you had huge amounts of cardiovascular disease. So when you realize that lead causes this kind of stuff, it was decided that lead is not safe at all. But unfortunately, we have a lot of lead in our body. How do we get it? From the air, from the paints that you have in your house. Your wall paints have lead. And so lead at any level contributes to increased related mortality from heart disease, from cancer, and from other degenerative disorders.
Dr. Lenny, how about mercury? Like
I'm coming to that. I'm coming to that. Just give me a minute. So this was the first study that came out in 2007, which clearly showed you that chronic lead exposure gave rise to chronic heart disease, gave rise to stroke, gave rise to arrhythmias, hypertension, and left ventricular hypertrophy, and to peripheral arterial disease. So this was one of the first studies that actually showed you that lead was directly responsible for heart disease. This was another one that showed you that lead was associated with myocardial infarction, that's heart attack, and with stroke. And this association was at less than 2 micrograms per deciliter. 30 was supposed to be normal those days. 2 at less than 2. And these came in big mainstream media, not in the mainstream medical media, that's Circulation, both journals of the American Heart Association. All right. Now, there are lots of mechanisms of lead toxicity. I will not get into this because this is more technical, but there are 2 things you must remember. If your homocysteine levels are high, and I will come to that and I'll show you what is high homocysteine levels because I have a chart on that. But if your homocysteine levels are high, it means that 2 important enzymes, the delta aminolevulinic acid dehydrogenase and glutathione reductase, both of these are inactivated. That's why your homocysteine levels are high. If your homocysteine levels are high, you have lead in you. And that is going to cause heart disease. So high homocysteine levels years before you get heart disease is telling you that you're prone to heart disease. One simple test, which nobody wants to do. It's very cheap, available in every lab, because most modern medicine and most modern cardiologists don't know what to do with it. They give you folic acid. It worsens homocysteine. They can't give you folic acid for homocysteine. They can give you folate for homocysteine. You need a methyl donor, not a methyl taker or receiver. All right. So this is one thing that you need to remember. So one, take home, homocysteine levels high, you're going to get heart disease. Now, this is as far as blood pressures are concerned. Again, lead was supposed to be responsible, and there are tons of studies to show you, both in men and women, that the moment you show lead, the age is not a factor at all. It doesn't mean that just because you get older, you're going to get hypertension. It is more because you are having a lot of bone degradation as you get older. A lot of lead gets into your blood, and that because that is sitting in your bone. So as long as it's in your bone, it doesn't harm you. But once it gets thrown into your blood as you get older, your pressure starts going up. And it's not because of age, it's not because of anything else, but it's because of lead. That is what a lot of studies have shown us. I've got tons of studies which I put up when I do my lectures for doctors. This is one with mercury. Shruti, you were asking me about this. Yes, this is New England Journal of Medicine. All right. They say mercury may. So this was a hypothecation. It was they hypothesized this. So they say mercury may promote atherosclerosis and hence increase the risk of myocardial infarction in several ways. So it promotes selenium, cannot serve as a cofactor to glutathione peroxidase. And so they've given a lot of reasons for it because they found that mercury and fish oils and the risk of myocardial infarction, this is what the authors wrote, this was the title. But what did they find at the end? They found that mercury levels were directly associated with higher risk of heart attacks, and that this partially offset the protective effects of DHA derived from eating fish. Why? Because they said that fish had possibly heavy metals, mercury in it, right? Now, they said the notion that methyl mercury contributes to cardiovascular disease is certainly a testable hypothesis and one that warrants further testing. Unfortunately, there was no further studies done on this. Now, having said this, my dear friends, if you have a proper nutrition that gets into your body, and why I'm saying this, if you have good amount of minerals, if you have good amount of magnesium, zinc, selenium getting into your body, where does this come from? This comes from your veggies. but it is not coming from your veggies, even if they are organic today. Why?
The soil.
Because the soil is not charged. The soil, you have dammed your rivers, so your rivers are not charging your soil. So you're not getting this. Ordinarily, if your soil was charged and you ate this fish and you got this mercury, then the zinc coming from the soil would have helped your metallothioneins that are there in your body to take this mercury and throw it out. That is how the body works. It takes care of itself, provided you provide it with the right kind of nutrition. We don't do that. So the bottom line is nutrition first. We don't provide it the nutrition, but we eat crap, and that hits us. Okay.
Also,
Then,
yeah. What?
Arsenic is the other one that hits you. I've told you lead, I've told you mercury.
Yeah.
Arsenic has got all of the atherosclerotic disorders. It has cardiovascular disease, hypertension, ischemic heart disease, peripheral vascular disease. Arsenic, my dear friends, is present in water. 90% of the water that we drink has got some amount of arsenic in it.
True.
India is the dumping ground of arsenic. Every fertilizer that is used for our veggies has got arsenic in it. The whole world doesn't use it, but India uses it. Okay. So heavy metal overload in adrenal glands also causes problems, decreased sex drive, and aggravation of menopausal symptoms. So what happens? The heavy metal overload has a whole wide range of issues that it causes in the body. You can have mercury and cadmium also inhibiting magnesium and zinc levels. So the lower your zinc levels go, the lower is the ability of your body to throw this out.
True.
But what it also does, it causes metabolic syndrome, it causes insulin resistance, it causes that insulin dysfunction, and it causes diabetes. Okay. So what happens? The unfortunate thing is that for adults, simple silent symptoms of chronic low-level heavy metal accumulation in tissues can simply show as just decline of energy, productivity, and quality of life, and can slowly then move on to cardiovascular disease, premature dementia, and total debilitation. But the problem is that we never consider the fact that you could have heavy metals in your body, and we never treat it, and that is the reason
Never even check it if you go.
And we don't even do it. Yes, so true, Shruti. We don't even do that. All right. And so, how do you remove toxins? There are various ways of removing toxins, but the most important one is what we do when we want to remove heavy metals. And before we do that, this is what you need to do. And if you have your phones with us, if you can see this slide, please photograph this, because these are the levels that you have to have if you want to remain healthy. Your homocysteine has to be less than 9.
It's going to be shared, and this is such an important thing. C-reactive protein, not many people, even the doctors don't even go and tell us to check.
Absolutely. Nobody does this. Homocysteine, why? Lipoprotein little a, less than 30.
Yeah.
Nobody does this. Do you know that in the last 2 months, every patient who has been prescribed statin had high levels of lipoprotein little a. Statin is contraindicated in a person with lipoprotein little a above 30.
Yeah.
Nobody has even checked this people. And that is the reason why when you do your angioplasties and bypass surgeries, you get your problem again in a year or two, because they have not checked your lipoprotein little a.
True.
Higher the lipoprotein little a, higher the chance of you getting repeat problems with your arteries. Nobody looks at it. And the last one, which is most important, insulin fasting.
Yeah.
Your normal levels in the lab will be 25. You can't have it more than 10. The moment you know it's more than 10, you are going to have diabetes, you are going to have heart disease in the next 3 to 5 years.
So many people have been diagnosed with pre-diabetes, especially after COVID, or I don't know if it's a very controversial topic, but after taking the shot, so many people have.
It has to happen because the shot itself has got a lot of impurities that cause insulin disruption. And that is the reason why I spent some time in telling you why insulin disruption is so important.
Yeah.
And what do we do for such cases? We do chelation. That is what I've been doing with EDTA and zinc, TTPA, and so many other chelators. So what does chelation do?
I love detoxing, especially the liver.
Yeah. So you detox the whole body.
Yeah.
We remove the heavy metals. EDTA chelation is wonderful for vascular disorders and atherosclerosis. All right. Yeah. I've been doing it for the last 20 years with great results. It is about 30 treatments over twice a week. And
Yeah.
if you can keep doing it, it is absolutely safe. It is supposed to be it's supposed to be about 1,000 times safer than aspirin. So you don't have to worry. It has been studied and checked.
Right.
And finally, is there evidence? So this was what was shown in Journal of American Medical Association. This was the TACT trial, which went on from 2007 to 2012. And in 2012, sorry, from 2002 to 2012, if I'm not mistaken. And from 2012, somewhere in November, I still remember I was traveling from Mumbai to Pune. And on the expressway, I got this, somebody told me, that time, we didn't have, so park the car and just listen to the speech there. And it was live at that point in time. They were announcing the TACT findings. And the TACT findings clearly showed that it did have a very good effect on people who had heart disease, especially previous myocardial infarction. And it was best seen with people who had diabetes. Why? Because people who had diabetes had bad insulin signaling. So you normalize the insulin signaling, your entire problem of heart disease goes away. Right? Now, I told you about three things already: cholesterol, sugars, exercise, food. Now I'm telling you about exercising.
Before that, Dr. Lenny, can you just tell us, because a lot of people I've got so many questions, and since it's before this, I would like to discuss the signals which we get. People often, the body gives you signals much before the heart attacks.
Yeah. So the number one signal will be your weight gain.
Yeah.
Why weight gain? Because weight gain tells you that your insulin signaling has gone for a toss. So insulin, what happens is the moment insulin starts becoming resistant, it starts pushing all your excess sugar into fats. It starts converting it, and you start putting on weight at the wrong places, on your belly, on your buttocks, and at all the wrong places. All right. So
then the waist ratio just gets
yes. So that's where the problem starts. Right now, you need to understand that that's your first sign. When you get that, you need to go and check this, along with your other basic, your kidney functions, liver functions. If you want to do cholesterol, do it. But you need to look at these 6 or 7 parameters, and they will show you some derangement. They will show you that there is some problem. The other thing that is not here is HbA1c. HbA1c is to check your sugar levels over the last 3 months. It's a glycated end product. Now, if it is anywhere between 5.5 and 6, which is pre-diabetic, you know that you are in trouble already. You need to get out of it. And this is where you can reverse it.
Right.
So these are the first signs that you're going to get. The other things that you need to look at, see, people generally come and say, I am feeling breathless. Pain is, of course, when you've already got the disease. So you know that you already have it.
Yeah.
But when you start getting breathless, probably that would be the first sign as well of heart disease setting in, because the blood supply is not good. But it could also be because you have low hemoglobin, especially in women. So that is the reason why the blood test is the first thing you need to do before you do anything else. So your normal blood counts together with this can put everything at rest. Number 3, you need to also understand that when you get pain or of any kind, it's not always that it is heart, because even your GERD, gastroesophageal reflux, can mimic chest pains.
Yeah, that's what I was wanting to talk about, the acidity and.
Yes. So always when you have that acid reflux, you will have it. So what you need to do is you need to get an echo done if you want, besides your ECG. ECG will tell you only when the pain is there. If the pain is not there, get your echo done to see if there's any damage to the heart. Because if there is, then most times they will say normal echo, but they will write one line. They will write a line there that says diastolic dysfunction present. Diastolic dysfunction present means that your heart is not relaxing properly. If your heart is not relaxing properly, that's the first sign that your heart is not getting enough oxygen. And it's not getting enough oxygen because there are blocks in your coronary arteries, which are minor, they are not major, but it is still there. It is the earliest sign of heart disease, which most cardiologists don't give you medication for. And one of my last slides is what you should be taking to prevent these things from having. And I will show you that as well. Those are supplements that anybody can take. They're not medications. I'll show you that as well. Okay. Can I go forward?
Yeah.
So, having told you about a little bit about chelation, I want to tell you about exercising right.
Yeah.
Now, I want you to remember that we were all hunter-gatherers. We were, at 70,000 years ago, we used to either run for our food or run away from being somebody's food. All right? So as hunters, we spent less energy in shorter duration bouts, but had nearly universally lower body fat than most farmers that came in much later, who spent the whole day in the farm. Okay, this was studied. There were studies done between the farming communities and the hunter-gatherer community.
Right.
Now, today's day and age, bodybuilders have only 4% of body fat, but they achieve this in shorter duration of exercise. Why and how? What does this actually mean? Does this mean that shorter exercise duration is better than, and what kind of exercise should we be doing? And so this is what I'm going to tell you in this few slides that I have put together, because this is a part of a bigger presentation that I have. So your body can select what source of energy it will use. So it can decide, I want to burn fat today, or I want to burn carbohydrates, especially glycogen today. Or should I burn protein to make, so I burn your muscle itself to get the fat, to get the energy from, right? So that is destruction of your own body that happens. Now, when you exercise for different durations or at different levels of intensity, it alters from the proportion of energy that you get from all these resources.
Right.
All right. So the first 20 minutes of exercise, the body uses something known as ATP. ATP is readily present in your muscles, but please remember something. ATP present in a muscle cell is enough to give you energy for all of 10 seconds. So it needs to constantly be recharged, right? And it needs oxygen for that recharge. So this is the most readily used available source of energy. Where does ATP come from? ATP comes from carbs, from sugar, right? Sugar gets in, goes through its various cycles, the Krebs cycle and the various cycles that it goes through, and finally it reaches and forms ATP. ATP is formed. You get about 38 ATPs in aerobic glycolysis. If it's anaerobic, you get only 2. So this is how the metabolism of glucose works about. But you can use this only for 15 to 20 minutes. After that, what happens? Your fat starts burning. So your body makes fuel choices based on your activity. So the moment you cross the level of exercise beyond 20, your fat starts burning. Now, just look at this and remember what I told you. First 20 minutes, it's your glycogen or carbohydrates present in your muscle. Then it's the fat that is present in your body. Now look at this. When you're sleeping, resting, your amount of fuel, or the fuel that is used, 60% of your energy comes from fat. Can you see that?
Yeah.
When you're doing low intensity, that means you're jogging or going for a 1-hour walk, or it is 15% fat. Sorry, when low intensity is very low intensity, that means you're generally lazing around and walking around or doing housework. This is 15%. But when you go for a walk, which is moderate intensity, or a jog, or a 1-hour run, see the fat used. 55% of it comes from fat. That means when you're resting, you have higher amount of fat used than even when you're doing moderate intensity.
Right.
So the high intensity doesn't use fat at all. It uses carbs. I want you to remember this, okay? Low intensity and high intensity uses the highest carbs, the lowest fat. But because they felt that moderate intensity used 55% fat, they should be exercising at this level. This is not really true. Let us understand why. Okay? So, for low intensity activity, the body derives most of its energy from carbohydrates and only 15% from fat. So when you look at the lifestyle of our ancient ancestors, they are walking for long distance, actually got a lot of the energy from carbohydrates. So they were walking slowly. Why? Because they had to go long distances to get their food and things like that. They didn't have a kitchen to go next door. They had to walk for long distance. They had to gather. So that made sense. Then when you go for moderate, your energy burn from fat is about 55%. This is why most people said that you should do exercise for that period of time. But they got that wrong because you can't get lean from there. Why? Because the moment you start burning fat, which is reserve energy for your activity on a daily basis, the body starts thinking that you need this fat for the next day, because next day also you will have this activity. So every food item you take in is shifted and stored as fat. So you're never losing fat.
Right.
Are you understanding? Right?
Yeah.
Now, when you go in for high level intensity of activity, so it's a high intensity workout. So here what happens? You were running. So in the good old days, you were running for your food, or you were running away from being somebody else's food. Now, what happened there? Those were life-saving activities. When you do life-saving activities, your body uses the highest amount of energy, the best energy that comes from glycogen in your muscle. Now you use that for a short intensity, short duration. The remaining 12 to 24 hours, your fat is burning to replenish it. Why? Because the main source of energy is always glycogen. And so what is the reserve going to do? The reserve energy is meant to supplement this. So when this is used, it starts getting converted to this. So the effect of this short dramatic activity has an after effect that lasts for practically a day, 12 to 24 hours, where you're constantly burning this fat. So if you're looking for weight loss and loss of the excess fat, you need to do this short bursts of exercise.
Yeah, that's what you said, that even in our programs, we do like 20 minutes of high intensity.
Yes.
And it's actually been researched a lot that people
exactly. I'm just showing you that now. I've got something here so people can see it. So endless gym time actually builds more fat. There's another reason for it, because you overdo it and you have cortisol release. So cortisol also causes fat gain. All right.
Yes.
I won't get into more of it. I just told you, but here is what I wanted to tell you. Short interval exercise creates an afterburn, which lasts you for 24 hours.
Right.
Okay. Finally, my dear friends, I need to talk to you about something that most people don't talk about: tackling stress. And I have just three points that you can take home with stress. Because if you don't tackle stress, all of what I said is useless.
Right.
Because stress itself causes that oxidation in your body and the inflammation in your body.
True.
And so these are the two mechanisms by which you get heart disease. And so you need to get rid of that stress. And how do you get rid of that stress? People tell me, Doc, you're talking nonsense. It's easier said than done. But let me tell you this. I tell every patient of mine, because I've seen it in my own life and I've seen it in the lives of all my patients. 3 things. Gratitude. So you get up in the morning, first thing, before you touch your phone, you be grateful for a new day. Many people have gone to sleep last night and have not woken up. You have another day. Be grateful. What happens when you become grateful? New neurotransmitters are released. That's enough evidence for that, right? Yeah. And so if you are grateful right through the day for whatever happens, there is less stress on you. Cortisol is never secreted, because what you are secreting is endorphins because of gratefulness. And endorphins are stress busters. Exercise releases endorphins. Exercise in the morning releases endorphins. The second thing that helps you is meditation and deep breathing. And there is enough of data that you can see. People tell you, do yoga, do Tai Chi, do whatever, do transcendental, whatever you want to do, you can do. But gratitude first thing in the morning will help you and set the stage for a good meditation. Third is, whenever you feel stressed, laugh. Fortunately, we talk bad about the phones and how bad it is on our lifestyle. But this is one place that you should use this phone. You have YouTube on this. Go there and you'll find so many comics giving you jokes which are 2-3 minutes long. I mean, look at them, laugh your guts out when you're feeling stressed. You'll certainly see that your stress levels have gone down and your thinking changes. And you become much more productive rather than become stressed out and feeling all lost and anxious and all of that. You can get rid of 90% of psychiatric disorders in this world if you do a lot of laughing. Laughter therapy is one of the best. And so, my dear friends, I want to leave this one last thing with you as far as stress is concerned. What I tell all my patients, my morning routine: get up in the morning, do 1 or 2 minutes, or even if you want to do it longer, that's your choice, but at least 2 to 3 minutes of gratitude, glass of water, go to the loo, get out and do your morning exercise for not more than 20 minutes. You do these 3 things early morning, you have set your day up, which is going to be absolutely stress-free if you want it to be. So it's in your hands. And finally, if you want to have a good heart, healthy heart, some of the supplements you need to take regularly, coenzyme Q10 and L-carnitine. Both of them help to give your heart good amount of energy, even if there is low oxygen. Magnesium is something that you cannot forget, because magnesium had to come in your salt. Yeah. But where do we use sea salt? We don't use sea salt. Absolutely. We use all kinds of salt, even Himalayan salt. We don't use sea salt. Yeah. Sea salt has magnesium. And so if you're not using...
Dr. Lenny, we are not absorbing magnesium properly.
Exactly. So ideally get a good salt of magnesium, not magnesium oxide. Magnesium glycinate or bisglycinate. Today it's available across the globe. Just get it. Niacin. Now here, niacin, people don't like it because the one that really works is the flushing variety. It gives you a flush. It helps your triglycerides to come down, and it prevents LDL from getting oxidized. Niacin is B3, all right? It's vitamin B3. Then you have vitamin C that you can have. In our Indian diets, we do have turmeric, which has got curcumin. Yeah. It will only get absorbed when it's tagged with an oligosaccharide. So it has to be in your curries, on your carbs. Yeah. So when you use it there, it will get absorbed. Otherwise, have curcumin separately. D-Ribose is for people who are into really big sporting events or who have heart disease. It's available. What is D-Ribose? Cane sugar. It is given in most temples as you get it in most of the temples. That's cane sugar. That is D-Ribose. You have a couple of those every day, 15 grams of it every day. It gives your heart instant energy, right? And then finally, omega-3 fatty acids and mixed natural tocopherols and tocotrienols specifically. I forgot to put that there. These play a huge role in reducing the oxidative stress and inflammation. And so the concept of LDL as bad cholesterol is too simplistic. Don't get into it, right? Don't focus on cholesterol. You need to look at other things that will reduce your stress, your oxidative stress in the body, and your inflammation. Ensure that you have a good diet. Do your exercise regularly. Get your morning routine done, and you will be fine. So please remember, if you feel that you are having issues, always think of detoxifying yourself. Find a good functional medicine expert who can detoxify yourself, because there are tons of detox protocols available that will help you. I'd like to thank you for giving me this opportunity. I think I took a long time, but I hope this has given you some value to help your health go to the next level. Shruti, thank you.
Thank you, Dr. Lenny. I think we have a lot of questions, and this session was very much informative. And what we would also, if I can just share my screen one second. Yeah. So, of course, what we said, we have to look at the artery health and not our LDL health. And that's why what we do in functional medicine practice is a very different approach, not your normal approach. We look into the body symptoms and many more other details as well, as Dr. Lenny was describing. And of course, we've gone through this. We've gone through stress management. Also, I want to talk now. We can have a lot of question and answer, and I've got a lot of question and answer. But let's just have 5 minutes, and we've already shot up the time. So, Dr. Lenny, I wanted to ask you about there is a difference between a heart attack and a cardiac arrest.
Okay, so a heart attack is when your area of your blood supply to a particular area of the heart. So a small arteriole. So okay, let's look at it this way. When you look at do your left fist this way, this is your heart. You put your 3 arteries on it. These are the 3 arteries that you see in an angiogram. So this is like your poles outside your house, that bring the electricity. From there is a wire that comes to your house. So from these 3, there are small arterioles that supply the muscle at various levels. So there are thousands of them going inside. Any one of those gets blocked, there's no blood supply to that area. That is when you get a heart attack. So the blood cells in that area, because there is no blood supply, die.
Right.
And they die, they release certain enzymes, so you know that the person has got a heart attack. Now, heart attack generally on its own doesn't kill you, but depending on how bad it is, it disrupts the normal rhythm of the heart. So there's an electric rhythm. So you have an electric impulse that goes from the top to down, which allows your upper 2 chambers to contract first and then the lower 2 chambers. So there is a rhythm to it. They go in a particular rhythm. It's never changed. Right. Now, when that gets affected, we call what is called arrhythmias. So these arrhythmias come about where your beats become irregular. And it's the arrhythmias that can kill you post a myocardial infarction or a heart attack.
Right.
So that is a heart attack. A cardiac arrest, on the other hand, is when the heart stops beating. Now, this can happen because of a heart attack, because it can happen because of an arrhythmia, or it can just go into an asystole. Asystole meaning it just stops functioning. Mm-hmm. Now, that could happen for any reason. So when you have a heart attack, you may not die, but you need to get to the hospital and people can give you medication. But when you have a cardiac arrest, it's an emergency which you need to immediately revive. Mm-hmm. You need to ensure to give you the resuscitation measures. Why? Because when you give that heart massage, just that shock of that heart massage can let the heart to catch that electric impulse back and it can start functioning. That's the reason why they give you those shocks. Why is that? So that it can just start beating again, right? So when the beat stops, it's a cardiac arrest. So that means the heart suddenly stops functioning. It just goes dead. Heart attack is an area of the heart that gets damaged, because of which you can get an arrhythmia. One of the arrhythmias could be a complete loss of the heartbeat, which can lead to death.
Great. Thank you so much. And you all can, if anybody has any questions, please ask. There is another question where somebody had asked about thickening of the heart muscles. Generally, a lot of people.
So thickening of the heart muscle is hypertrophy.
Yeah.
Hypertrophy normally happens when you have high blood pressure. Now, please understand what high blood pressure is. You have your arteries. Those arteries are normally nice and easy. They become big and they become small. They kind of expand and contract. Now, when you have them getting atherosclerosed internally, they become hard as pipes. So there is no expansion and contraction. So let's say in a particular area, you need extra blood because you're running. So the artery has to expand, but it's not expanding. But the heart knows that you need it. So the heart is pumping blood now to increase the amount of blood reaching there. So now it has to pump extra against this pressure. When it has to pump extra against this pressure, you start getting hypertrophy. That means the heart muscle starts becoming bigger. It becomes thicker. And at some point when it overdoes it, it starts thinning and it starts dying. So first is hypertrophy and then it starts thinning and starts dying off because you are overdoing it. So it's like, overusing your muscle and what happens when the muscle starts itself dying because it doesn't get energy from anywhere else. So hypertension causes the thickening of the heart wall, especially the left ventricle.
Okay, that's great. Another question is a very controversial question. Vaccines and heart attack.
Yeah, so let me explain this to you. And this is not something that Dr. Lenny is saying, or that somebody who doesn't like vaccines is saying, or somebody who's against the vaccines is saying. There are studies that are already published in the Lancet and the New England Journal of Medicine, which clearly tell you the pathology of what the crown protein does, okay, the one that on which the entire vaccine is based. So when it enters your blood vessel, it is looked at by our immune cells, specifically the T cells, and the killer cells as basically a foreign body. So when it sees this crown protein getting stuck inside the artery somewhere, the T cell comes and hits there. And when it hits there, it causes that intimal damage. When it causes the intimal damage, the plaque formation gets in. Why? Because there is now damage there. So when there's damage there, there's an inflammation. So if you get a cut on your skin, there's inflammation over there. How does that inflammation take place? That inflammation takes place because the white blood cells, the macrophages, all the other components of the immune system rush there to heal you, to remove what is bad and to heal you. So this whole immune reaction starts taking place within the artery, leading to the plaque formation, because that is the basis how a plaque formation first takes place, which I was just showing you earlier. So that plaque, once it is formed, it can suddenly occlude the artery and you can get heart attack.
Right.
And so people get heart attacks because of this. There is enough evidence to show you this. There are enough studies that have come out that it does happen this way. And so one of the things that many doctors, even mainstream cardiologists, are doing is they're giving patients an aspirin to prevent some of these aggregation clotting factors from coming together, specifically your platelets from aggregating together and causing those sudden thrombi that can go and cause those severe blockages. So they do give it to most of the patients who do take vaccines. And I also tell all my patients, you've taken a vaccine, you can't do a shit about it, at least take aspirin once every night. There is no protocol for that respect. If you talk to people, they will say it's not required, but there is a good number of people for protection's sake give it. So the medical community is divided on this. I personally give it to my patients.
Great. So I think it was it's almost 7:18 and we've overshot the time, but thank you so much. And I'm looking forward for such more sessions. It was very, very informative and I'm sure it'll help a lot of people. Thank you so much for joining us. And of course, for the people who are looking up and on Facebook and YouTube, thank you for joining, and do post your comments and we'll be back with our next webinar. Thank you, Dr. Lenny, for spending some time with us. It was
Thank you, Shruti. Anytime, you're always welcome. And I hope people have got value from what we have set out. Please let me know if there are any questions and they need to answer. We'll be glad to have them.
Definitely.
Thanks, Shruti, for having this. You're doing a great job.
Thank you so much. Thank you.